Welcome to SmileFy. Today we will explore how to start a new patient, how to prepare the maxilla and mandible images for designing and printing, and how to calibrate your files. Select New Patient on the main menu, then select Patient Digitalization. You will need a picture of your patient with a full natural smile. Pause the video and check these tips on how to take the perfect picture. We can now add the picture. Choose from one of the options and select the patient's picture. Now, let's also add the maxilla intraoral skin file and also the mandible. Make sure the files contain the patient's bite registration. Notice that these files are in the open mesh condition and therefore not suitable for printing. Once you've added the files, click on Calibrate. In this step, we are going to correct the position of the maxilla image. Focus on the maxilla image below, and use the others to help you level the model like the given picture, on right top corner of the screen. Use the rings to rotate the model. Once you've achieved the correct position, click on Save. Within these options, you can choose to analyze and fix errors. Also, you can optimize your files if your files are too large. SmileFy will select this option automatically. If your maxilla model is on the open shell condition, you can select either close mesh or mesh wall. It is recommended to also select the option Mesh Edit to prepare the model. Check how each model condition looks like and choose closed mesh or mesh wall for your project. In the Mesh Edit tool, we can start by making a cut in the entire model to reduce its size. Delete unnecessary areas and smooth the edges of the image. Click on the button Cut and a plane will appear over the model. All areas inside the box will be removed. We can select the box, move the plane using the arrows, and also rotate the plane to adjust to our needs. Leave 6 to 10 mm above gingival margins. Once you've set the position, click on Apply. Next, we will be using the brush tools to further clean up the model. Here, we can use the tool Mark to select an area we wish to remove. Simply paint the area and click on Delete Area. We can also smooth the edges of the image. This will result in a cleaner printable model. Choose the size of the brush and the intensity. Once you've finished, click on Done. Let's repeat the same process for the mandible. Make sure to rotate the plane to cut the bottom part of the image. We will now calibrate the files so the maxilla matches the picture. This will help us by showing how the new smile looks on the patient during the entire design process. First, start by positioning the model similar to the picture. Then you will select 3 points in the model, starting from left to right. Try to stay at the incisal edges if you can, or choose easily identifiable spots. On the picture, drag the points to imitate the model. If you would like to change the position of a point in the model, click on the point. It will begin to blink. Select the new spot. Once you have put all points in their place, click on Calibrate. Make any adjustments using the tools on the right side of the screen. You can click on Outlines to check the calibration, and once you're done, click Next and save it. Choose Case Management from these options to go back to your patient's case. At this time, the files added in the calibration data is being sent to our servers, where the images will be processed, segmented, and returned to your app in a brief moment. Please allow the app to finish this process. In the meantime, we can create any simulation, or even initiate a 3D smile design. However, to use the automated 3D design, simplified mockup, and ortho simulation, we must wait a bit for them to become available. The process is completed. We can now use all types of design available. Thank you for watching this tutorial, SmileFy, your path to a perfect restorative treatment outcome with digital dentistry.